Okay, yes, this is a great question. Let me tell you things that I don't like to hear in report. Obviously, these are my opinions. Everyone receives and gives report differently, so take this with a grain of salt. But the first thing I don't like is when people jump around a lot in report. And I understand that sometimes you're like, oh shoot, I forgot to tell you this. I'm not talking about those situations. I'm talking about where the whole report is just like bouncing all over the place and it's really hard to like keep it organized. The next thing I don't like is when nurses have to explain everything. And what I mean by this is if like the patient's been here for 6 weeks, I don't need to know day by day by day by day that they had like a chest x-ray this day and they had a thoracentesis this day and then they had a head CT this day and the next day they had an abdominal CT this day. I don't want to know every single thing unless it's pertinent. It just gets too cluttered, too messy. I can't keep track of all of that. I would rather, if it's pertinent, tell me. I don't need to know like specific dates for everything that's happened over the last like 6 weeks. The next thing I don't like is when nurses report unnecessary things like labs that are completely normal. Unless it helps paint the picture, I don't need you to go through and say white blood cells normal, hemoglobin's normal, platelets normal, AST, ALT normal, K's normal, MAG's normal. Like, just tell me the things that are out of range, if you corrected them, if we're doing anything about it, and that's that. The last thing I don't like is when nurses give too much of their opinion in report. And what I mean by this is I don't like to be skewed on how to view the patient. So some nurses can like really give a lot of hefty opinions on the patient's maybe personality or family situation. And if it's pertinent to how we're caring for the patient, of course, tell me. But I don't need to know like your opinion on them because then I'm automatically going in biased on what you told me. So I like to keep things very black and white. You can give factual information, but try to avoid opinions. And I'm not talking about an opinion like, yeah, I'm thinking they may have heart failure or something like that. I'm talking like, oh, this patient was just so annoying all night long. They're driving me absolutely crazy. This patient is nuts. You can tell someone that a patient's driving you nuts without actually calling them nuts. You can say, hey, this patient calls on the call light frequently. They're frequently asking for pain medicine or things like that, and without giving like too much of your opinion. So I hope that makes sense and I hope that's helpful. Remember, my ICU report sheet's still on sale if you made it to this point in the video, and that is a great resource to help you guys stay organized and avoid some of these things that I'm talking about.